Not ev- Not every NEET student is actually meant for Bachelor of Ayurvedic Medicine and Surgery. So before choosing it, watch this video once and decide wisely. After NEET you have multiple pathways like medical courses, non-medical courses, behavioral health sciences, etc. In today's video we will talk about one of the rising career course, that is BAMS. Let me give you a rough idea about BAMS. It is a 5.5 years of course including 4.5 years of study and 1 year of internship. In case of more details I have created a shorts regarding it, so do check it out. I will attach the link below in description. There are two categories of students choosing BAMS, the ones who are genuinely interested while the others who think of it as an optional course. People often think about BAMS as a middle route, but reality is much deeper. So today let's dive deep where I will be guiding you as a BAMS student. Firstly, academics. Most common concern of all students regarding BAMS is about Sanskrit. It's not really hard while not everyone's cup of tea. As you already study Sanskrit as a separate subject in first prof itself. Secondly, practical exposure. Similar to MBBS, you as a BAMS student also have to deal with dead body, that is dissection. However, the clinical exposure varies according to different colleges. And lastly, career confusion. What to do after BAMS? Post-graduation or job or practice, etc. If you are someone who is interested in clinical practice but lacks skills, then don't worry, I have a great news for you all. Stay tuned up to the last part of video where I will be revealing that. Scope and career options. Clinical path: you can own a clinic, etc. Work in hospital or wellness centers, etc. Teaching field: if you are someone who is interested in guiding students, then you require higher studies like MD for being a lecturer or professor. Research and pharma related field. Jobs in Ayurveda companies, etc. Why? Because of high demand upon manufacturing, testing, research, quality check, etc. Government jobs in health department. UPSC or state PSC has many posts available like medical officer, healthcare department, etc. Salary reality. Fresh graduate gets paid around 20,000 rupees to 40,000 rupees per month. While in the government sector, for example, medical officer gets paid around 40,000 rupees to 58,000 rupees per month. The allowance in private sector is much lower, around 15,000 rupees to 30,000 rupees for a fresh graduate. The salary grows with experience. Check mark. Who should choose Bachelor of Ayurvedic Medicine and Surgery? Interested in Ayurveda and holistic healing. Enjoys patient interaction. Ready for long-term growth. Interested in wellness and preventive healthcare. Comfortable with entrepreneurship, private practice. Can study both modern and Ayurvedic subjects. Passionate about healthcare. Good communication and empathy skills. Interested in yoga, nutrition, lifestyle medicine. Who should not choose BAMS? Choosing only because MBBS was not possible. Expecting instant high salary. Dislikes Ayurveda completely. Wants only allopathy style hospital life. Choosing due to family or social pressure. Interested only in the doctor tag. Cannot handle slow career growth initially. Not interested in patient care. Constantly compares BAMS with MBBS. Wants quick success with minimal effort. Don't choose Bachelor of Ayurvedic Medicine and Surgery just for the doctor tag or as an MBBS backup. Choose it only if you genuinely connect with the field and can see yourself growing in it for years. So, here I am helping you all who are struggling with clinical skills. Let me introduce you all to CRAV. Rashtriya Ayurveda Vidyapeeth CRAV. After Bachelor of Ayurvedic Medicine and Surgery. Full form, Certificate of Rashtriya Ayurveda Vidyapeeth. Duration 1 year. Eligibility BAMS plus internship completed. Purpose practical clinical training under experienced Ayurvedic doctors. Benefits better hands-on experience, patient handling, clinical skills. Important it is a training program, not a government job exam. Follow and